Hello everyone, this is our presentation on trauma-based family therapy. I'd like to speak a little bit about Charles R. Figley. So some other major theoretical influences were Reuben Hill. I thought this was a pretty powerful quote. Trauma is by nature. So Figley started to piece together that his interviews with Vietnam veterans, key terms and definitions, trauma. When an individual experiences an event, core tenets of the theory. Trauma affects the whole family system, not just.
The first goals of trauma-based therapy is helping clients feel physically and emotionally safe. Many trauma survivors remain in the heightened state of alertness long after the traumatic event has ended. Therapy focuses on reducing symptoms such as anxiety, depression, flashbacks, nightmares, hypervigilance, and avoidance behaviors. Clients are supported in processing traumatic memories at a pace that feels manageable, allowing them to make sense of their experiences without becoming overwhelmed. Developing healthy coping skills and emotional regulation strategies helps clients manage distressing emotions and triggers. Trauma often impacts self-worth and personal identity, so therapy works to rebuild confidence and a sense of empowerment. Therapists also help clients strengthen supportive relationships and reconnect with healthy social networks. Ultimately, trauma therapy aims to help individuals move beyond survival and experience growth, resilience, and improved quality of life. The therapist's role is to establish trust and create a safe space where clients feel respected and understood. Trauma-informed therapists recognize how trauma affects thoughts, emotions, behaviors, and relationships while avoiding practices that may re-traumatize clients. Therapists assess the client's trauma history, current symptoms, strengths, and available supports to develop an individualized trauma treatment plan. A key responsibility is teaching grounding, relaxation, and emotional regulation skills before engaging in deeper trauma processing work. Therapists guide clients through exploring traumatic experiences while allowing them to maintain control over the pace and depth of disclosure. Empowerment is central to trauma therapy because trauma often involves a loss of control. Therapists encourage client choice and collaboration through treatment. Therapists continuously monitor emotional responses and adjust interventions to ensure that client remains within a manageable level of distress.
Clinical techniques and interventions for trauma-based family therapy. I'm going to go over the cultural considerations for trauma-based family therapy.
Looking at what's eating Gilbert, this is an illustration of a genogram. The family presenting clinical concerns.
A trauma-based family therapy approach would focus on helping the family understand how trauma and grief have influenced their current functioning. The therapist would first work to establish safety and trust within the therapeutic environment, allowing family members to openly discuss difficult experiences and emotions. An important focus of treatment would be helping the family process and resolve grief related to the father's death. Family members would be encouraged to share their individual experiences of loss and explore how grief continues to affect their relationship and daily lives. Gilbert's treatment would focus on addressing the effects of parentification, chronic stress, unresolved grief, and caregiving burden. Since Gilbert has assumed many adult responsibilities after his father's death, therapy would help him balance caring for his family while also developing his own identity and future goals. First would be process grief and loss, explore emotions related to his father's death, identify how unresolved grief continues to affect his daily life, increase ability to express sadness, anger, and frustration in healthy ways. Interventions would be trauma focused and grief counseling, narrative therapy techniques to help Gilbert share his experience of loss, exploration of family changes that occur after his father's death, and journaling or reflecting exercises to process emotions. Second would be reduce caregiving burden. I recognize the impact of excessive responsibility on his well-being. Identify responsibilities that can be shared with other family members and increase self-care activities and personal time. Interventions would be psychoeducation about caregiver stress and burnout. Develop a balanced schedule that includes personal interests and social activities. Explore feelings of obligations and responsibility and practice stress management techniques such as mindfulness and relaxation exercises. Third would be to address parentification and boundary issues, differentiate between appropriate family support and excessive responsibility, develop healthier boundaries with family members, reduce feelings of guilt associated with focusing on his own needs. Interventions would be cognitive behavioral therapy to challenge beliefs such as I must take care of everyone or I am selfish if I leave. Family therapy sessions to discuss role redistribution, boundary setting exercises, and assertiveness training, and also exploring of Gilbert's personal identity outside of the caregiving role. Four is support independence and future planning. Clarify personal goals, interests, and aspirations, increase confidence in making decisions for his own future, develop a realistic plan for balancing family obligations and independence. Interventions would be strength-based counseling, goal setting, and problem-solving exercises, career, educational, and relationship exploration, and encourage engagement in supportive social relationships. Amy's role within the family has shifted significantly since her father's death. She has taken on many household responsibilities and often functions as a caregiver, which may leave her feeling overwhelmed, stressed, resentful, or emotionally neglected. While she works hard to support her family, these responsibilities may limit her ability to focus on her own needs and personal development. In therapy, it would be important to provide Amy with a safe space to express her feelings about the pressures and expectations she experiences within the family. Treatment would also focus on helping her process the grief associated with losing her father and explore how that loss continues to affect her emotionally. Additionally, therapy could help Amy develop a stronger sense of identity outside of her caregiving role, allowing her to pursue her own interests and goals. Building healthy coping strategies, improving emotional neglection, and strengthening communication with her mother and siblings would also be important treatment goals. Finally, validating Amy's contributions and recognizing the challenges she faces can help her feel supported and understood while promoting healthier family relationships. Ellen, as the youngest child in the family, may have experienced emotional neglect as much of the family's attention was directed toward caregiving responsibilities and managing ongoing stress. As a result, her emotional needs may have been overlooked, making it difficult for her to feel heard or valued within the family system. In therapy, Ellen would be encouraged to openly express her emotions, thoughts, and concerns in a safe and supportive environment. Treatment would focus on helping her explore how family stress and loss have influenced her childhood experiences and emotional development. The therapist would also work with Ellen to build self-esteem, increase emotional awareness, and strengthen her relationship with family members. An important goal of treatment would be ensuring that Ellen feels recognized, supported, and valued as an important member of the family.
The role of the therapist in the case of the Grape family would be to validate the family's trauma response and their struggle in managing it. The therapist would validate Gilbert's burnout and provide psychoeducation to assist the family in understanding Bonnie and Gilbert's trauma responses of freezing and numbing. Given the many layers of issues happening, the family would require not just talk therapy, but additional supports to alleviate the caregiver burden, address the trauma, and provide resources to lift the parentification off Gilbert. Bonnie states at one point that when Gilbert failed to come home, she'd become scared, and this was similar to the lead up to Mr. Grape's suicide, showing that not knowing the whereabouts of her children triggers her trauma response. The family, being trapped in the caretaker role for both Bonnie and Arnie, kept them in a survival loop. Bonnie's weight and immobility have become a protective factor to keep the family close. The family possesses many strengths and shows resilience in their ability to come together and support each other. Addressing the Grape family's trauma presents a unique challenge as Bonnie has limited mobility, so attending sessions at the therapist's office may not be a viable option at present. To accommodate this, I would recommend telehealth sessions for the family when Bonnie is participating. This also may present a challenge as the house is the source of the trauma, given that Mr. Grape took his life in the basement. The technique of in vivo mastery and safety, which provides gradual exposure to triggers, would be difficult to use as the family is living in the home that is the source of the trauma. Extra care would need to be taken to make the home a safe space to process their trauma. The goal of the therapy would be to reduce the burnout experienced by Gilbert, assist the family in processing the trauma and grief, and shift the parental role back to Bonnie. Despite Bonnie's physical limitations, she could assume the parental role through decision making. One important aspect would be to assist Bonnie in developing healthy coping skills to manage her depression and weight, which are a result of her response to the traumatic event. Teaching Gilbert emotional regulation skills would also be vital as he numbs himself and goes through the motions so the family functions. However, he lashes out and hits Arnie when he could no longer numb himself. Bringing in outside resources and supports would also be an important asset to this family's success. To assist the family with financial challenges, assisting Bonnie with acquiring Social Security Disability Insurance, or SSDI, for both herself and Arnie, as well as Supplemental Nutrition Assistance Program, or SNAP benefits, would be imperative. This would assist Gilbert in having to work less, as at one point he identifies that he has had to work extra hours in the past just to feed Bonnie. Additional services that could support the family would be enrollment in Office for People with Developmental Disability Services, or OPWDD, for Arnie, which he could attend and participate in activities and be monitored as he often elopes. This could also provide the family some respite from the constant vigilance he requires. This would allow Gilbert to develop a sense of autonomy, which he started to experience when he met Becky. At the end of the film, as Gilbert attempts to introduce Becky to Bonnie, Bonnie resists, but Gilbert states, "This is what I want," which shows him expressing his own needs and desires for the first time.